We are this year celebrating our 35th anniversary being hospice, and we feel so grateful to Talbot County and the support that Talbot County has extended to us for 35 years. They're the reason that we're here. That we thought on the occasion of our anniversary that we would like to give a gift ourselves to the community. So we've come up with an initiative that has an event for everyone in the community connected to it. But our initiative is called Talbot Conversations, Making Your End-of-Life Wishes Known. And our goal is to try to get every adult in Talbot County to complete an advance directive and have a conversation with someone in their family about their end-of-life wishes by the end of the year.
Many times in my career here at Easton, first as Chief Medical Officer at Shore Health, and now as Medical Director of Hospice, I've been in the room with families who are worrying about a medical decision. And typically there's a room full of siblings, brothers and sisters, who are talking about Dad. And Dad is sick, and everybody loves Dad, and people have gathered from around the county and maybe even around the country to figure out what's the best thing for Dad. And some of them say, you know, Dad's had a good life, we love Dad, we need to just take care of him and let him go ahead and go. But then others who love Dad just as much say, that's my father. I want the best for him. We're not going to give up on my father. He's a fighter, and we're going to take care of him, give him whatever he needs. Doctor, whatever you need to do, you do. The one problem with that is that there's a voice missing in that conversation, and that's Dad. Because Dad's sick in the hospital bed and really can't participate in that conversation. Decisions get made. I mean, they have to get made. But what's left behind is a dynamic of some bitterness and resentment and those sorts of feelings within a family that initially started with a common theme of we love Dad. And all that could have been avoided if Dad had taken the time to have a conversation with his children and to write down, this is what I want at my end of life. That's a legacy that Dad left by his inaction. He's left a legacy within his family of a problem that may take a long time to work out, whereas he could have given what we're calling a gift to his family of making his wishes known, of having a conversation.
There are essentially, in Maryland, 3 things that we can complete that would be helpful both in legal terms and in medical terms. And the first one is what is, I think, the most essential, is to find someone, whether it's a friend or a family member, or I do meet people here who have chosen lawyers because they don't have family members and they don't have a close friend who's young enough. Pick someone that they feel they can explain to what it is they want if they were very seriously ill, and that person has the ability to represent them, doesn't feel emotionally conflicted or intimidated by the people who may ask them questions about why I chose that. So picking what in different states or different media is called a healthcare proxy, a healthcare agent, a medical representative is probably the most essential. And the second form is also a legal form. That the healthcare proxy gives somebody, I give someone authority to speak for me, and otherwise there's an automatic process under the law that chooses who that person is. Secondly, we legally can fill out a form that describes what we would want in the event of future serious illness or accident. and that often is called the living will or medical choices. Both of those forms are legal forms. In the state of Maryland, we also have a more successful option that's been available for the last few years called the medical order for life-sustaining treatment, which is also sometimes called a physician order for life-sustaining treatment, which is a medical document, a medical order, a medical prescription, which is the only thing out of all of these three that's effective within the medical system, meaning emergency medical services, nursing or other medical facilities, and the hospitals, to show that these choices that we've made about various kinds of medical interventions and life support are medically binding.
I guess we weren't sure exactly what we were going to be talking to churches about. And it just kind of evolved that the pastors were talking about families not having that done. Family members not knowing what they wanted at the end of life. And how sad it was for pastors to be working with these families and seeing the relationships between kids and other people in the family kind of deteriorate and sometimes never come back to one another after the death of a parent. And they said, if there's any way that you can help us with that, that's really what motivated us, because we weren't sure what we were going to talk about. We thought we'd be talking about hospice only, and then it became more of talking about having a conversation with your family about your end of life. It helps out the family. It's a gift to your loved ones, but it's also a gift, I think, to the pastors that are working with these families.